Hi there, everybody. Thank you for joining us today. My name is John Burke, and I'm going to be moderating today's discussion on our webinar here for disinfectant fact and fiction. So over the next half hour or so, we're going to be discussing a wide range of topics centered around 2 certified disinfectants manufactured by ICP Group that are effective against COVID-19. We'll also be going over application methods and provide you guys numerous ideas and tools so you guys can create an effective plan for your business and your customers. So before we get started, I do want to introduce Andrew Morris. He's our National Sales Manager here at Chemical Concepts. And leading the discussion here today and the presentation is Cole Stenton from ICP Group. So before handing it over to Cole, I do just want to let you know we're going to be monitoring the Q&A section. So feel free to write any questions in there or the chat box. We'll monitor that. We'll answer questions as we go, and we'll certainly hit them after in our Q&A section post presentation. So Cole, feel free to lead the way.
Okay. Great. Thanks, guys. Thanks to Andrew, to John, to Lydia, to everybody at Chemical Concepts for putting this together. It's always a pleasure to do a co-sponsored education session. My name is Cole Stanton. I'm the Director of Education, Architecture, Engineering, and Design Specification for ICP, that's Innovative Chemical Products. And in the context of the COVID outbreak, the COVID pandemic, we are providing support through our channel partners like Chemical Concepts to help our end users, our institutions, our applicators who want to become more versed in how to do surface disinfection, with everything from surface hygiene to cleaning to understanding what disinfectants do. And we're going to touch on a lot of this as we go through. I'm not going to get into my biography, but it is here. It's going to be in the recording if you really want to have a cure for insomnia. But basically for 25 years, I've been doing environmental work for ICP. And that has led to a lot of work on prior pandemics. So a few items of housekeeping on recording, slides, and more. One of the most common questions we get, the third most common question is this being recorded and am I going to get the recording? Part of that is to be answered by John and Andrew, which is using this Zoom format. Some packages deliver it automatically, but yes, you have access to the slides. You also have access to the recording, and the recording will, at least in one place, be at masterworkscommunity.com. This is our customer community. This is open to not only our distributors, but also our contractors and also our specifiers and our building owners and our institutional directors. This is where you can get information on everything we do, including videos, specifications, and the new coronavirus mitigation specification, which looks something like this. This is everything we've learned over the years about pandemic and epidemic translated into the common language of architecture, operations, and construction. And that should be loaded this weekend in its new version onto Masterworks, or if you're interested in getting a copy or participating in our peer review, just send me an email at specifications@masterworks.com. So if you would like to access this spec, go to Masterworks Community, icpmasterworkscommunity.com, register. It's very simple and straightforward. It's just a username and a password, and then select all learning, and then go to the disinfection catalog, and you will find the training recordings and many, many other infection and sanitizing materials. And it's going to look a lot like this. It really couldn't be easier, and it's going to be this recording and a host of other recordings. We have done over 100 training sessions since mid-March, since March 11th, for more than 4,000 attendees. So we have a lot of material that we've created, often for very specialized niches, like things you wouldn't think of, like dance studios, dentist offices, that sort of thing. So ICP is a disinfectant manufacturer, but we're not just a disinfectant manufacturer. We make 26 brands of construction products. That's over 14,000 products that service over 150 distinct architectural processes in construction. Our disinfectants were born out of crisis response, emergency response, and disaster response, everything from water damage to fire damage to mold to floods to hurricanes to wildfires. And so these products are strong enough for the disaster conditions, but they're also practical enough to be used every day as a vaccine for the surface. And we're very unusual in that we have 2 different platforms. We're not just backing one horse. We've invested in both a conventional quaternary ammonium chloride platform, which is our Shockwave brand, the flagship brand in mold remediation, for example, and a botanical brand, which is all naturally derived, the first and only EPA registered authentically botanical technology on the market today. And that's the Benefect brand, which we acquired in February of 2019. And so we have both tools to bring to the table. Is one better than the other? Both have distinct advantages. It's like tools in the toolbox, whether you're looking at pH or whether you're looking at microorganism lists or whether you're looking at the type of sprayer you can use, we can help you, but know that we've got this versatility. You know, the disinfectant marketplace, it helps, I think, before we have a conversation about disinfection and COVID, to understand how big it is. It is over $3.5 billion, disinfectants in the United States alone. And annualized over the last 5 years, it typically grew at about 3.5%, but last year it had already grown almost 7%, and those are pre-pandemic numbers. So what that means to you if you're running a business, whether you're an installer looking to do disinfectant services or whether you're an institution of higher learning looking to do dormitories or whether you're food processing, know this, that the demand on disinfectant supplies is going to be far higher than it has ever been. In fact, our raw material suppliers are already struggling to keep up, and we haven't even seen the acceleration wave that is anticipated for the cold and flu season that's coming. So one of the messages, if you're taking notes or to highlight when you watch the recording, is ensure your supply. You know, talk to your suppliers and say, are you going to be able to keep what I need in stock? You know, and think about how much you need to back stock, more than usual. And that goes for wipes and hand sanitizer and disinfectant. The disinfectant marketplace is also very bipolar. 72% of the market are the 6 brands, and that's it, 6, that you see in one form or fashion on the shelves in the supermarket or in some of the commodity supply stores. The other 28% are where you have the specialists, the high performance products, the products that are geared towards particular solutions and particular pressure tested situations like pandemic response or hurricane response. And that's who we are. That's who ICP is. We're not looking to make commodity disinfectants. We're looking to provide the special tools when the conditions are at their worst and we need to get the conditions back to normal. So that's where we're coming from. We are, you know, not taking a commodity product, a consumer product, and relabeling it or writing up a COVID flyer and saying, here you go. We actually have a history and a background in this business. And that's what you want to look for, whether it's us or someone like us. So the title today that Chemical Concepts wanted me to operate under was Disinfectant Fact and Fiction. Now, actually, I've got more material than we can possibly do, more than a half an hour, so we may find ourselves getting caught up, or I may end up going very fast, but we'll try and get through as much of it as we can and leave some time for Q&A. So this is copyright material, but if you have an audience that you'd like Chemical Concepts and us to present to, just let us know. Topics to include, as you saw in the webinar invite, some common misinformation and misconceptions. How do we prepare effective action plans, so-called IDERs and EOPs? Differences between conventional and botanical disinfectant systems. We're actually going to touch on that just a little bit. But more, we'd like to spend some time on application methods and selection because that really helps you conceptualize how you're going to disinfect in the first place. Now, disinfection is a very primal response. We've all been watching the media, however you consume your media, and every story from the journalists out there talking about every aspect of the pandemic always seems to include spraying, fogging, spraying, misting, spraying, wiping with a rag, disinfection all over the place. And that makes some sense. It's a healthy response because we are responding to something invisible that we know can hurt us. And we're responding to something invisible that we know can disrupt our lives. NPR had a story today where they did a poll in 4 of the largest American cities and found out that 1 in 4 poll respondents had lost their job. So, you know, as we vacillate between recovery and further recession, you know, we're worried. We're worried about feeding our families. We're worried about kids going back to school. We're worried about people getting sick and passing away. So it's okay to be fixated on disinfectants. The problem is when we overfocus, when we look at disinfectants as a panacea, as something that's going to make it all better, make it all go away, because that's not how it works, especially not with viruses. What we will repeat in this presentation over and over again is There is no substitute for disinfection on a regular basis, at least daily. There is nothing that we can do to surfaces to make disinfectants go away. The best way to look at disinfectants, and there are some absolutely outlandish claims on the internet, is to think about it through the lens of chemistry. The chemistry determines how we clean, which we have to do before we disinfect. Then it determines how we disinfect. Do we use an electrostatic sprayer or do we use a Swiffer? And then it also tells us how we're going to prioritize our efforts in terms of how we're going to budget staff time, whether we're going to hire an outside contractor, who's going to be doing what floor first and working out from this space to that space to avoid cross-contamination. And then finally, it's about how we set expectations. We got expectations sometimes in emergencies that are born out of desperation. We want to believe things so badly. We were hoping for something to be easier than we know in our heart of hearts it is. So owners have to have expectations. Directors and managers have to have expectations. Installers have to set the right expectations. Customer service people for Chemical Concepts have to set the right expectations. We all are in the expectation business because we're stressed and we know that this is a very complex situation. How do we know all this at ICP? Because it's not our first rodeo. This happens to be my list of experience. We have other subject matter experts with similar lists. But going back, well over 15 years, I was looking at it this morning. I was writing a commemorative article in our chatter feed about how 15 years ago we disinfected the Superdome after Hurricane Katrina. It's hard to believe it was 15 years ago. And it was after that experience we started working more with FEMA and with the Association of Contingency Planners and started getting involved right away with the influenza outbreaks that were happening with swine flu and bird flu. And then original SARS in 2002, 2004, Ebola and EVD68 in the summer of 2014, norovirus every year, avian influenza outbreaks in poultry farms that never make it to humans every year, Legionella every year. So we understand what's involved with pandemic. We also understand that there's a lot of misinformation about disinfectants, which has been demonstrated at multiple levels as the months have gone by. So brief fundamentals. Disinfectants are treatments for touchable surfaces in the indoor or outdoor built environment. So let's parse that down because that sentence is absolutely key. Touchable is what we're concerned about. Are we concerned about ceilings that are above a drop ceiling? No. Are we concerned about ceilings in the first place? Usually, no. Are we concerned about outdoors? Well, maybe. Most viruses aren't robust enough to last for very long outdoors, but if I've got an area where everybody in my business goes out and eats lunch, maybe I want to treat that after lunch. And that's not at all uncommon. And in colleges and universities, for example, that's something common that has to be considered. Disinfectants are also not one size fits all. They kill targeted microorganisms. So they're tools in the toolbox. And you have to read the label carefully. The label is the law. The label is registered by the Environmental Protection Agency, and it is the law. So if something doesn't appear on the label, you have to talk to the manufacturer about why not. And if the manufacturer can't give you a good answer, then go find a different product that has the label claim that you want. And then finally, disinfectants are proven. This is not something new. Ever since Joseph Lister, who lent his name to Listerine in the 19th century, introduced the idea of carbolic acid as a microorganism control, or basically a health conditions control, since the science of microorganisms really didn't blossom, so to speak, until the 20th century. But in the 1840s, thanks to Lister and other pioneers, we were doing disinfection. And disinfectant is the word of the day. Disinfect is what everybody is being asked to comply with. It is the #1 word when it comes to surface hygiene, epidemic, and pandemic, SHEP, which is a term you'll hear, SHEP, surface hygiene, epidemic, and pandemic. And I've been reviewing all of the state, federal, association, private, and public guidance I can find and get my hands on. And I'm keeping a running tally of how often I see the word disinfect versus how often I see the word sanitize, and I put that graph on screen. 95% of the time it's the word disinfect, 5% of the time it's sanitize. Why? Well, because there's actually some science behind these words. They're not interchangeable. Think about it this way. If you have 1 million microorganisms that you don't want and you treat them with a sanitizer, you're going to kill 99.9%. That's 19 after the decimal point, which will give you 1,000 remaining microorganisms, which is a lot less than 1 million, but it's still a lot. If you disinfect, it's logarithmically better, 99.999. That's 3 nines after the decimal point, 99.999% kill, which means your million microorganisms is now reduced to a statistically negligible 10. And that's why disinfect is the word that we're using. Is it 100%? No. Is it 0? No. Beware those terms. Don't use them in your business. Don't use them in your operating plans. And if people use them around you, think carefully about whether or not you want to work with those people. Last fundamentals I'm going to touch on. Disinfectants typically work by ripping the cell open. Viruses are single-celled microorganisms, so are bacteria. They work by tearing them open and therefore ruining their integrity. That means that for that to happen, you need the active ingredient and the disinfectant to come in contact with the cellular wall of the microorganism. So active ingredient, cellular wall must come together. How do we do this? They're not self-propelled. Well, we get the surface wet. Wet means there's no friction. It means that things that are floating in that liquid can come together, especially if they have opposing electrical charges. And that's what's called motility. That means our active ingredient can find the microorganism and kill it. Now, it doesn't happen right away. It happens within a certain contact time. And for COVID activity, your contact time for surface disinfection to get not just the virus, but all the viruses, bacteria, and molds, all the commonly occurring ones, is 10 minutes. You may see faster contact times. They don't do you much good if you do surface testing and find out that the surface is still reading negative, reading positive for microbials, because the tests we're using, ATP tests, are pass-fail tests. So 10 minutes is what you're going to need to pass an ATP test or a similar evaluation. So to achieve 99.999% kill, we need to get rid of any dirt that's in the way, any interference, and then we need to allow a dwell time, a wet surface time of 10 minutes. That's what we're talking about when we're removing soil load, and that's why systems like this don't work. We unfortunately see things like this on a regular basis. You know, walk through tunnels, it's not my words, it's EPA's words, it's CDC's words, are ineffective. And in fact, can be considered hazardous when they're spraying hypochlorous acid or sodium hypochlorite bleach or other oxidizers onto people walking through without wearing personal protective equipment. And ultraviolet lights, while they are being used in some places, maybe inside the ductwork of air handling systems, generally, they don't work in this type of application because they're not focused enough to kill and have a sufficient dwell time to kill microorganisms. And even when you can put in powerful enough lights, like say inside an empty subway car, any side of the surface that's in the eclipse, that's in the shadow, won't be disinfected. So ultraviolet light, sprayed disinfectants, walk through tunnels, these are not on EPA's list N because EPA can't demonstrate that they work. By the way, if you find a miracle product on the internet or one is proposed to you, one of the most simple things you can do is go to Google Earth and put in the address. And if you go to Google Earth and you end up with a Qdoba, a GameStop, and a UPS store, you know that probably this isn't a legitimate manufacturer. This is probably someone who's having buckets made for them, and they're not even touching them, and they're shipping them, and they don't even own the technology. So Google Earth, really great trick. So SARS-CoV-2 pandemic is a microorganism. It's a beta coronavirus. It's one of the 4 types of coronavirus. And we have coronavirus in this country, by the way. And that's what when you see a disinfectant that says coronavirus on the label, that's either the original version SARS, or more likely it's coronavirus 229. Which causes 30% of the common colds every year during cold and flu season. So we have coronaviruses to which we are already accustomed to living. Its problem is this is a new disease, it's a new strain that we haven't encountered before and against which we have very little to no existing immunity or resistance. We also have no EPA registered disinfectants because we've never had this disease or this microorganism available to test against in the lab, and we still don't. Gradually, we'll be able to test in the laboratory and develop label language for SARS-CoV-2, the coronavirus, the beta coronavirus that causes COVID-19 disease. But for a while, we're going to have to use EPA's List N, and I'm going to talk about List N in just a second. But first, I want to talk about what's called one-step disinfectants. So one-step disinfection is a term that's being abused right now, but it's a very valuable term in pandemic control, in SHEP, in surface hygiene epidemic and pandemic, because there are a lot of surfaces that we want to use a disinfectant on, but aren't all that dirty, that don't need to be cleaned. So when we have visually clean surfaces, nearly clean surfaces, we can put on the Shockwave Ready to Use or the Benefect Decon 30, allow it to be wet for 10 minutes, and then allow it to air dry or wipe away if need be. A good example would be the reception desk at a hotel, or a windowsill that is along a walkway, but that no one's actually touching. Those surfaces can be treated with the disinfectant as a one-step disinfectant, as listed on the label, if it has one-step disinfectant statements on the label, as you see here in the blue box. But where we always clean is anywhere we have viral load. So bathrooms, lavatories, doorknobs, surfaces near people that are sick, there we're going to use the disinfectant to clean, and we can use just the one product. We don't have to go find another product. If you can, if your disinfectant supports that, which ours do because of the history with disaster restoration. You don't want two products. I mean, it's just too complicated to have a cleaner and a disinfectant. So clean and then disinfect with a 10-minute wet contact time, and then allow to air dry or wipe away. Those are the parameters that you have to have that are different between a one-step cleaner and disinfection and cleaning and disinfecting. So I know that's a little foggy, it's hard to follow. So, and what you have to use is one of the products on EPA's List N. Again, List N is only liquid disinfectants. It does not include anything that resists viral growth on surfaces and keeps surfaces safe. It's not a protectant. It doesn't include ozone. It doesn't include gases. It doesn't include ultraviolet light. And it doesn't include vapor in terms of products. What we're looking for are liquids that can be directly applied to surfaces so we can see where we're going and make sure we have them wet for the contact time. So EPA has special lists for special pandemic outbreaks. They started at List A, they're now on List N, kind of like how NOAA does hurricanes. So when you're using this list, you can use the EPA interface on epa.gov, which is fine, and you'll find that our products are registered there. But what I'm encouraging everyone to do is to use this tool. EPA also has this List N tool, which is far easier to understand, far easier to follow, more user-friendly. It tells you what surfaces you can use the product on. It tells you what it's made out of, and it tells you whether you can use it in healthcare and institutional and residential, or only 2 of 3 or only 1 of 3. And that's important because if a disinfectant says it can be used in healthcare and institutions, but not residential, then it should not be used in homes, whether you're using it in your own home or whether you're providing it as a residential service. Same goes for if it's not, listed here as List N and healthcare, then it shouldn't be used in healthcare. And then you get gray areas, like a college I was working with the other day that wanted to use it on campus, but they're not going to use it in their dormitories because the product doesn't have residential on it. Now, that's not our product. All of the ICP products have healthcare, institutional, and residential, so you don't have to worry about it. But this is a great tool, this List N tool. But remember, it's also just a starting point. List N, which is the list created of acceptable disinfectants to treat COVID-19 disease, until we get actual labels, until we get actual testing. So it's an interim list. That interim list is just a starting point. It's well over 400 products by now, over 200 of which are quaternary ammonium chlorides like Shockwave RTU, only 1 botanical disinfectant that's authentic, that's a Benefect, and I think there are 60 or 70 different bleaches. So there's a wide range of products to choose from. It's like Auto Trader. You want to buy a car? Here's cars. They all have 4 wheels, but from there, you got to review the features, functions, and benefits, the old FFB, that you want that's particularly appropriate to your business, to your crew, to your dynamics, to your facility. And then ask the manufacturer what's not on the label. Do you provide subject matter expertise? Someone like me. Do you provide supply that's going to get me through the second wave? Do you have a list of surfaces you're compatible or incompatible with? All the information that's not on the label. So EPA List N is a valuable tool, but you have to know how to use it. Remember, only put in the first 2 parts of the registration number, as you can see here. You try to put in all 3 parts, it's going to basically conk out and crash on you. So let's talk a little bit about the pandemic. We don't need to spend a whole lot of time on the pandemic, although I will share one did you know that just came out in the media today. I just heard over lunch. the County of Los Angeles Health Department has now banned trick-or-treating. So truly strange times we live in. I was just talking to my kids last night about trick-or-treating and getting them excited about it. Just, you know, one more sort of domino, right? This is what we're looking at globally. 27 million global cases. This is the Johns Hopkins dashboard. I'm going to show you three dashboards that I think are really helpful. Remember, this is being recorded, so you can go back and you don't have to scribble them down. We are looking at almost 900,000, you know, so we're pushing 1 million fatalities, and we will top 190,000 in the United States probably today. And India has just overtaken Brazil in total number of cases, although Brazil certainly has a massive numerical burden, a much higher burden of deaths. So, you know, it's horrible. We're getting a little numb to it. We're getting fatigued by it, but it does benefit us to face up to it. And sometimes dashboards are the easiest way to do it. This is another one that a lot of the veterans of pandemic battles use that is proven to be very popular, covidexitstrategy.org. And this measures a lot of different attributes to determine the dark red states have uncontrolled spread. There's a story, for example, behind South Dakota. The Sturgis motorcycle rally that just happened a couple weeks ago had 400,000 people attend. And now they're estimating that 260,000 new cases are directly attributable back to the Sturgis rally. The health costs are being estimated at over $12 billion just from that super spreader event. So this COVID exit strategy dashboard tracks ICUs, how much ICU capacity is available. It tracks testing and how much testing is done as a proportion of population. It tests how good the contact tracing is. And as you can see here, I've put up the last couple of weeks. And while there's some fluctuation, there's also some consistency. Dr. Fauci mentioned today that 8 states in the Midwest stand at very high risk of spiking. And he added to the dark red ones that are on here already, Michigan, Indiana, and Ohio, and Minnesota, probably among others. This is how COVID exit strategy measures. These are some of the criteria they measured. I put New Mexico and Arizona up as examples of states that are rather isolated and rather similar to show you how different the experience can be. This is the third dashboard I would encourage you to look at. I look at this both in terms of the state, and I also look at the one provided by my state for my city and town. My city and town right now is down to 0.28% R value. R value means reproduction. It's how quickly the virus is reproducing and infecting. And it means if you're over 1, that means you're in pandemic because you're infecting more than 1 person for every sick person, which means exponential acceleration. If you're less than 1, and you'd be on the green part of the chart you see on screen, then you are having less than 1 sick person for every person already infected. And that's good. That's the only way we're going to reduce the infection. So this is another great barometer. It's free. A lot of people don't know about it. And it's got great history on it. So here again is New Mexico. I was doing some training for a big group there on Friday, thus the slides. And you can go all the way back to the beginning of the epidemic and see how high we were above 1 and where we are at now, which is right at 1 on the right-hand side of the screen. There's been all this talk about a second wave. You know, the head of the Warp Speed Commission, the vaccine generation group, was interviewed by one of the news organizations just recently. And he had a very disappointing and depressing statement, which was there won't be a second wave, which sounds good on its face. He said it's like a forest fire at this point. It's just going to keep burning whenever there's human wood available to burn, which is, you know, stomach churning. What you're seeing on screen here is the Spanish flu of 1918 from the retrospective at the Centers for Disease Control. Will we see something like this, or will we see the forest fire metaphor be more truthful? We don't know. What we do know is late summer, before cold and flu season, before a lot of people go indoors, we are probably at our best situation now, and it's going to be somewhat downhill from here, which is why there are already changes to the construction industry in terms of new construction requirements. You're going to start seeing, for those of you who are involved in construction, COVID safety plans, if you haven't already. There's a designated COVID officer and supervisor on every big site. Architects are starting to put out specs that have coronavirus mitigation steps in there, like don't share tools, and if you do share tools, here's how to disinfect them. There's going to be brand new communications that are used in companies big and small in terms of worker education, in terms of right to know, conditions of employment to participate in the disinfection and preventative programs. And there are going to be a lot of challenges because we're going to have construction sites that are idle for long periods of time, and that's going to mean mold and Legionella. Make sure your business of any kind has a COVID safety plan that is designed to protect and mitigate against, that's a great word, I want everyone to use that, mitigation strategy you see on the screen there. Mitigate against infection of staff, occupants, visitors, customers, clients, all those. Mitigation means you're doing the utmost that is possible. And that would include having written guidelines on testing, tracking, isolation, and social distancing. And strict site access. Signing the book on the way in and out has got to be enforced. And we're starting to see that. And for large general contractors in the big cities, they're already having to sign sworn affidavits by legal counsel or ownership that they are going to do their utmost to mitigate against the spread of disease. So let's talk a little bit about guidelines, specifications, and right expectations. First of all, I'll save you some time on Google. There are no established guidelines. There are no laws. There are no rules. There are no regulations. There are just recommendations and guidelines for epidemic or pandemic, but there will be. This is the tipping point. Much as Katrina was the tipping point for hurricanes, this is the tipping point for outbreak. That we are finally going to have organizations, at the very least, industry organizations will pull together and develop guidelines that will eventually get adopted by certain states as regulations and may even get adopted at a federal level. Right now, there's no licensing. You can go on EPA's coronavirus frequently asked questions, and there is a frequently asked question right there that says very bluntly, no licensing is required to do pandemic control work. So cleaning and doing disinfection, for example, there is no requirement for a license. There may be state requirements for the use of antimicrobials, but those are few and far between and certainly not getting reinforced during these times. But this licensing void will not last. And there's a chaotic mix of recommendations in terms of what training applicators of disinfectant should have. So for the most part, big institutions that have good training systems, good education systems, good continuing education systems are training up their own people. But there's a lot of situations also where we need emergency response, specially trained folks, or we just need folks who can come in and do this work because we're already at capacity with our people and what they're able to do. So what do we need to do? We need to have plans that say, we're going to be responsible and accountable to make sure we're cleaning and disinfecting, doing both. Notice that. You'll always see clean and disinfect together because CDC and EPA both have on their frequently asked questions statements that say, can I just clean? And the answer is no. Can I just disinfect? And the answer is no. Clean and disinfect to the extent necessary to mitigate, there's that word again, against the exposure of guests, customers, visitors, members, and staff to the virus on touchable, there's that word again, surfaces, touchable surfaces. So that provides some parameters. We're only worrying about touchable surfaces, but we've got to do this often enough and well enough to mitigate against exposure. CDC and EPA, while CDC has revised their recommendations multiple times, their recommendations on disinfectants have not really changed, which means between Chemical Concepts and ICP, we can help you. Disinfection is about the most stable part of the recommendation mix. And if we can help you develop plans to take disinfection off the table, so it's a done issue, it's running smoothly, it runs by itself, people know what to do and what to use, then we've really accomplished something, and you can move on to more difficult things like how to space children in a school 6 feet apart when the classroom's already got 30 kids in it. That's what you need to be worrying about. Let us help you with disinfection. So what EPA and CDC have said from the beginning is cleaning and disinfecting will require 3 things. Develop a plan, implement the plan, and make your plan a living document, except that it is not going to be done ever. It is going to be maintained and revised on a regular basis. And this gets to the issue of frequency, time and time again. I apologize for the slide, it's way too dense. But know this, the recommendations are all over the place. If you're in Arizona, you have different rules than you do in Alaska, you have different rules than you do in Massachusetts in terms of how often you need to clean and disinfect. And that also depends upon, is it a gym, is it a spa, is it a cafeteria, is it a dormitory? The majority of the recommendations call out daily. which obviously is usually more like off hours or nightly. CDC, when they came out with their revised guidelines for the schools, one of the very few things they were blunt about is at a minimum daily. And that includes bus companies and transport companies, etc. Also, the words that are used all the time are routine, regular, disinfection, and what they're asking that institutions do is intensify and increase. These general terms aren't very helpful, but you know, however, that if you're responsible for a facility or you're selling your services to a facility, you need to be able to justify how what is being done is more intense and increased than over the routine and regular effort you were doing before. You have to enumerate that in your documentation. And sometimes your customer-public interaction makes a difference. Like in California, after each diner at a table, the table needs to be disinfected. Well, that table's got a 10-minute wet contact time, and you got to wipe up the wet. These are things we need to do. What kind of turnaround time do you have between classes going in and out of classrooms? And does that need to be shifted to accommodate disinfecting contact time? During services in church, places of worship, if you have multiple services in a day, how closely can we schedule those? And remember also there's starvation strategy. The virus doesn't live forever. It's like a radioactive element, and it's going to decay over time to the point where it's no longer infectious. But we're seeing recommendations like, well, if someone was sick, wait 24 hours. If someone was sick, wait 72 hours. As we'll talk about, those are kind of arbitrary numbers. We've got reason to believe that the microorganism could be infectious 2.5 weeks out. So we've got a big disagreement in terms of the recommendations that are out there. But what we do know is, regardless of what kind of business or institution we're running, we've got OSHA right to know and general duty clause requirements to protect our people. And if we're asking them to work around a disinfectant or even use a disinfectant as part of being empowered to be part of the program, like a spray bottle or wipes in a bathroom, then we need to make sure they're educated. We need to make sure they know what their obligations are and also when to step away. We need to have certain visual communicators, whether they're window decals or doorknob hangers or something for guests and for staff to tell them this is how we do things. Sometimes we're going to have to provide wipes, and if we can't buy the wipes because they're unavailable, and they are right now for months, maybe we have to make our own. So CDC is very clear. Regular cleaning staff can clean and disinfect community spaces, but they have to be trained on the proper use of chemicals. Now, here's the fork in the road that EPA and CDC don't tell you about, which is you actually need to have 2 plans. You need to have 2 plans that each do the same thing. One plan is for infection prevention. How are we going to clean and disinfect to prevent infection? Basically, it's a numbers game. Let's reduce the viral load to the point where if someone touches that surface and touches their eye, they're very unlikely to become infected. And that's going to involve developing a plan, implementing a plan, maintaining and revising a plan, and that's going to be the everyday plan. As opposed to your EIDR or your EOP, which are your response plans that roll into play when someone has been infected or is suspected to be infected. Again, you're going to develop these emergency plans, you're going to implement those plans, and you're going to revise those plans, and it's going to continue to be a living document, but you're going to have 2 sets of plans. And there's going to be certain language of art involved in terms of everyday preventative activity is what I was describing before with the word SHEP, surface hygiene, epidemic, and pandemic. This is our everyday thing. Our COVID positive might use the word EIDR, which is what the NFL likes and made it into the mainstream media. So everyone was excited for a couple of weeks about writing an EIDR, which is just an infectious disease emergency response. That's all that means. An EOP, or an emergency operations plan, is the similar acronym that the states use. What it boils down to as far as disinfectants are concerned. So there's a lot of differences between an emergency plan and an everyday plan, except where disinfectants are concerned, it's really not all that different. If surfaces are visibly dirty, clean them. Apply the disinfectant. Make sure it's getting that 10-minute wet contact time, and adjust your delivery method, which I'll show you in a second. And then make sure you touch your touch points. And all of this is in the specification that you can get on the Masterworks website. Now, I had my email wrong before. It's specifications@icpgroup.com or cstanton@icpgroup.com. And this specification, guys, is huge. 70 pages. You're not supposed to use all of it. It is a compendium. It's everything all the subject matter experts could think of put into a living document that we continue to build every single day, so that when you need to go to something and say, you know what, I need recommendations for escalators. I need recommendations for pantries, that you can actually have a place where you might find some good stuff that'll help you with a better plan. And, you know, I talked about the third most asked question is, where is it recorded? The second most asked question is, how long does it work for? The number one asked question is it EPA approved? And we've already talked about EPA List N. So List N is take care of the first problem. Second question is the most common question we can't answer, and nobody can. Let me be clear. Nobody can promise lifespan beyond disinfection. In other words, once I have used the disinfectant, if someone who is infected coughs on that surface, sneezes on that surface, speaks or sings, that surface is contaminated. And the only way to address it is regular cleaning and disinfecting of public facilities. And we've got to ramp that up when people are sick, and we've got to pay special attention to our hotspots. So when you see things like this, for example, where it is a shield product that doesn't leach and it doesn't react, and it's a physical structure at the microscopic level, go to EPA, go to their frequently asked question, which I've highlighted here, and it says very clearly, EPA's words, not mine, there are no publicly available EPA registered products that are registered for use as residual antiviral surface coatings at this time. There are against bacteria. And that's what's happening is people with technologies to resist odor-causing bacteria have come up with these elaborate marketing programs showing that their product creates invisible nails and spikes that magically attract the microbe out of the air to the disinfectant on the surface, and this long-lasting disinfectant pierces the microbe and kills it. Pins, swords, whatever you want to call it. This is, of course, hooey. The products that have a lengthy period of microbial resistance are bacteria only, and typically only odor-causing bacteria, and it has nothing to do with spikes or swords. It has to do with, there's a little bit of quaternary ammonium chloride, the same active ingredient we use in our Shockwave product, in 98% water that, oh, by the way, you're probably paying more than $100 a gallon for, $100 a gallon water, and there's a vinyl that's holding that quat onto that surface. And typically it's for textiles and fabrics. So it's designed to be sacrificial. The textile gets wet, the vinyl dissolves, the quat can move around now. Remember, motility in the wet environment. It can kill the odor-causing bacteria by ripping the cellular wall open, and we get less odor as a result. That's all these things do. They're not a replacement in that highlighted language. That's also EPA. Not a replacement for systematic cleaning and disinfection. So again, I'll repeat, there are no publicly available EPA registered products, EPA's language, that are registered for use as residual antiviral surface coatings. We have to disinfect. And we have to disinfect because while the most common touch point, most common transmission route is sneezing and breathing without wearing masks, infected persons can also contaminate surfaces, and then we touch those surfaces and touch our eyes, our mouth, our face, our ears, anywhere we have mucous membranes, and we can infect ourselves. When you hear news stories that say CDC has said that it's low risk, remember, those news stories are reflecting it is a lower risk relative to someone infected breathing on you. It doesn't mean it's not a risk. It doesn't mean you're not disinfecting, because we have data as published here in March in the New England Journal of Medicine and published elsewhere since, showing that the SARS-CoV-2 virus in the middle column is more robust than its predecessor, SARS-CoV-1, and certainly more robust than influenza. And we clean surfaces because of flu all the time. So we know that human beings touch their face on average more than 20 times per hour. We also know that even though the coronavirus data shows it can remain viably infectious for more than 3 days, we also have field data, such as this from the Diamond Princess cruise ship, from CDC's weekly report, showing that in this particular situation, while there was very little that was left infectious, they still found infectious SARS-CoV-2 RNA on the cabin's surfaces 17 days after both infected and uninfected, symptomatic and asymptomatic people had disembarked. They had left the ship. So means we have to be concerned about surfaces that could harbor disease up to 2.5 weeks later. So let's talk about delivery methods right here. Now, this is what we're not doing. We're not fogging. We're not driving down the streets of Wuhan and spreading mists everywhere. This is not what EPA or CDC want. They do not accept this. They do not recommend it. They don't tolerate it. You are not supposed to use fumigation or wide area spraying. In fact, what you're supposed to do is change your delivery method with the size of the area you're looking to treat. So your smallest areas, your touch points, get wipes. You can use hand trigger sprayers for small areas. Bear in mind, hand trigger sprayers have the worst performance in terms of creating a good spray that gets every nanometer of a surface. Far better to use a compression or pump sprayer like you see here, whether it's a backpack design or a carry along, whether it's Chapin, Milwaukee, B&G, whatever brand you want to use. Pump up sprayers, compression sprayers, garden and bug sprayers, whatever name. These are really simple, familiar. They don't cost much. They don't need much training. And some of them even have foaming tips, and foaming is really helpful because we don't like runoff on vertical surfaces. Speaking of which, foaming applicators. So if I'm doing a prestigious stockbroker's office or law office and I'm doing their elevator doors and frames, I don't want to spray those and have it all run and drip in the expensive carpet underneath the door. I want to make sure I put my disinfectant where it goes. I want it up there for 10 minutes. I want it to then dissipate, or I can wipe it away. Foaming is an excellent technique for this. It is so helpful on big, high prestige jobs, but it's slow. It's slower than any of the spray methods, including electrostatic, except when electrostatic doesn't work. And by that, I mean, electrostatic is wonderful stuff. It works by charging the liquid of disinfectant coming out of the machine. And if you can spray it to a polarized and grounded opposing electrically charged surface, like if you're painting an airplane or powder coating something in a shop, the disinfectant will almost magically travel to the surface. However, there's a lot of things in this world that we're handling with COVID-19 control that can't be polarized, that can't be grounded, that can't be charged. Think carpet, tile, composite, wood, most plastics, even some metals. You can't charge. So that means the electrostatic action doesn't take place. In fact, EPA does not have any electrostatic spray instructions on any approved product. They just have the word spray. Right now, they're doing research at Triangle Park in North Carolina to develop electrostatic instructions because they recognize that people are inadvertently abusing this technology. They're walking up and down the aisles of airplanes or movie theaters, and they're just hitting the trigger and spraying, and it's supposed to go everywhere it's supposed to go, right? I don't have to worry about it, right? And I get 1,000 square feet per gallon. That's not true. If you're not getting a 10-minute wet contact time, if you're not getting wet contact time at all, then you're not accomplishing anything. Now, one other tool, we already mentioned electrostatic and foaming. The third big tool for surface areas is ULV fogging and misting. You are not supposed to set up a mist or a fog like a flea or tick bomb and hope it gets everything. You can use misters or foggers to clear an area if you're concerned about things floating in the air by setting up foggers like the one on the left, Tri-Jet fogger, it's a hurricane fogger, to create a fine mist that will make everything that's floating in the air wet and therefore heavy and bring it to the ground where we can mop the floor. That's a great technique if someone has been sick in that space. Or you can use a hand-carried elephant nose fogger or Nicro fogger like you see on the right, and you can use that in small but complex geometry spaces like emergency vehicles, ambulances, subway cars, police vehicles, where setting up an airless sprayer would be too much work. Now, the last thing I will mention are the airless sprayers, which are, for the first time ever, being used in pandemic control because we suggested it. We saw it being done in flood response by some of the charitable organizations that we donate truckloads of Shockwave to every year, people like Send Relief, Southern Baptist Disaster, Samaritan's Purse, etc. We saw some of their volunteers using airless in Harvey a couple of years ago in Houston, and said, you know what? There's something to that. So whether you're using a tall paint sprayer, like you see here, these are all Graco equipment that's pictured. You can also use Titan equipment. I'm going to show you Titan equipment on the next slide. Or a Santa sprayer, which is actually a new type of airless sprayer designed just for disinfectants, which is cordless and more portable and simple. These are easier to field fix. They're more durable. They cost a lot less money. They're not back ordered 5 to 6 weeks like the electrostatics are. And they go where you put the disinfectant with better wetting characteristics and solving surface tension and holdout that you have with small droplet like ULV foggers and electrostatics. So let's look at airless. This is how we originally started seeing airless used. This is what happens if you put a disinfectant through a paint sprayer without changing the pressure or the the tip size, the orifice of the tip, you get enthusiastic blasting of everything, which is going to give you your 10 minutes wet contact time, but also a lot of collateral spray, including in the air system, as you did right there, which you don't want to see done. Instead, as we change the calibration and work with sprayer manufacturers, this is what we like to see, because this is what can be done efficiently in schools, in offices, in buildings, and you can use the same equipment to go from vertical surfaces to horizontal surfaces, to go to carpet, etc. So again, I want to touch back on this one. Snapshot in time. We have to clean, we have to disinfect. The word disinfectant is in all the mandates, all the requirements, all the recommendations say disinfect over and over and over again. And disinfection has to be done on a cyclical, responsible, intelligent basis that we can teach. And we've got to do it more often when people are sick, and we've got to handle our hot spots and our touch points. Remember, your plan should look like this for both of your plans, for your emergency plan and for your everyday plan. If it's dirty, clean it. Use an EPA list N disinfectant in accordance with the contact time, and then make sure you hit all your touch points. So that is the end of the academic content. I want to remind everybody we have both a conventional and a botanical platform for you. Conventional is Shockwave Ready to Use, which is quaternary ammonium chloride for porous and non-porous materials, killing over 120 different microorganisms, which is remarkable. And that includes over 30 different viruses. And as a ready-to-use product, it saves time and labor. All of our disinfectants are available in everything from gallons to 275-gallon totes, and our Benefect botanical products are also available in wipes. We also have trust documents available through some of our marketing programs. So I've got Dance Studio owner here as one of the national organizations that we developed some hang tags for, some floor decals, and labels that can go onto spray bottles and onto secondary containers, and floor decals. And we've done this from everything from, as I said, small dance studios to airports. That we call those trust documents. And then we have data sheets, fact sheets, and pictographic guidance sheets designed for different levels of audience of those who are interested in pandemic. That's the end of my material today. I'd like to thank everybody, and I can see that we are a little under an hour. So I'm turning this back over to Andrew and John. Thanks, guys, for having me.
Great, Cole. Thank you so much. Really appreciate it. Andrew here. This is Andrew's slide. You can always reach us at Chemical Concepts. You can email us at sales@chemical-concepts.com. You can also call our offices, 1-800-220-1966. And then we have all this information available on our website as well. Andrew, you want to finish off the presentation here?
Yeah. So thanks, John. Thanks, Cole. So wow, that was a lot of great information. So yeah, just real quick before we continue with the Q&A, I just wanted to say, feel free to contact us, after the event if you'd like to discuss further. You can see the contact information. We'll flash that again on the screen towards the end when we wrap up the Q&A. But we'd definitely be happy to discuss your specific situation and help you guys develop a solution that makes sense for you. Also, let us know if you want more content like this. So if you have a team internally that is looking to learn more, we could set up a video call either with Cole or another representative from ICP. We can answer any questions or deliver kind of a condensed version of some of what you saw today if you'd find something like that helpful. And then on a related note, as you can see on the slides, we can assist you also with other social distancing products and items for COVID-19 preparedness. We're helping a lot of companies with hand sanitizers, tapes, markings, removable signage. Apart from the disinfectants, a lot of people know us for our expertise in adhesives, sealants, tapes, and other specialty chemicals. That's kind of our main core competency is in product assembly and manufacturing. So we could certainly be a valuable resource in that respect as well. So anyway, with that, I'm going to hand it back over to John, and we'll start the Q&A section. I see we already have some questions that have kind of started to fill in, and so we'll get to your questions now.
Yeah, cool. So I have one here. It was from John here. He's asking about surface types. So does contact and wet time include regular treatment of fabric touch surfaces like chairs?
Yeah, good question. And I could have done 10 more slides on that section. So disinfect is not only defined as 99.999%, it's also defined as hard non-porous surfaces only. The moment you move to a porous material, it's called sanitizing. Not the same sanitizing as before. EPA uses the word sanitizing multiple ways, so it can get complex. But anytime you're working on a fabric or anything semi-porous, it's sanitizing. So expect 99.9% kill. And yes, when CDC says to a school that you're supposed to do that lecture hall at least once daily, that includes the fabric. Now, the trick with fabric is, I know what I'm worried about is the virus. The virus is not deep in the cushioning. The virus only survives outside the body in globs of mucus. This is one of the reasons when people say, oh, well, the virus is so small, it's going to go through any filter. Yeah, coronavirus is, you know, maybe 20 nanometers, but the glob of mucus that it gets aerosolized in is 6 to 10 microns. So it's eminently able to get caught in a HEPA filter. Anyway, back to what I was saying. So the virus will survive in human exhaled material, and that's only on the outermost surface of the fabric. So your job is to use the antimicrobial product, whichever you choose, to get that outermost surface of the fabric consistently damp for 10 minutes while trying to avoid getting it wet all the way through. Because wetting all the way through means complications with drying, which means mold. So I hate to give you such a loose answer, but the nature of your fabric, the juxtaposition of your fabric, the treatment that your fabric may have received, all that stuff makes a difference. So you've got to test surface by surface and say, okay, on these chairs, we're going to do this. On these other chairs, we're going to do this. I've had to do this at my church already. We were having a meeting last night saying, how are we going to handle some of this? We have wooden pews that were built in 1902. Well, we found out the disinfectant causes them to look terrible, to look all cloudy. So I switched products. I use a different product for that, a specialty neutral disinfectant for finished wood. Sometimes you got to do that sort of thing. But anyway, John, to go back to your question, fabric, yes. It should be done with the same frequency as hard surfaces. Just change your words and change your practices.
Thanks, Cole. I have another question here asking about air disinfection. What are the what's your thoughts on that?
So when the pandemic started, I was wondering about air disinfection myself because it hadn't come up in a while. And I went back and did some research because I remembered television commercials for a product called Oust, O-U-S-T. And it talked about disinfecting the air. As it turns out, all of those EPA registrations are no longer in force. EPA backed away, for lack of a better phrase, with air sanitizing. And all the claims, by the way, were also bacteria only. There weren't any related to viruses that I could find that even had existed in the past. So air sanitizing is not an EPA registered thing anymore. It was once upon a time, and that's why you'll see it in old documents, and that's why you might read about it. But I found zero evidence that any product has an air sanitizing claim. Now, what you can do, and the best way to handle it, is what's called a pull down. Take your airless sprayer or your ULV mister fogger, turn the settings so that your droplets are as small as possible. You want the smallest possible droplets because you want them to hang in the air for hours, if not days, and spray the air in that room, starting from the highest point, working your way around the room, back toward how you came in, creating a circle so that the air is evenly treated. And if you've got enough micro droplets, then the chances of collision with that dust particle that has the virus on it increases to the point where you can count on most of it being on the floor when it all settles out, and then you can clean it up. So that's what's called a pull down. Asbestos guys have been doing it for years as their final step before they tear down containment. So it's a proven technique.
So with the pull down, would you say, is it recommended for most, so say schools and something like that? So is a pull down something that they should be concerned with doing? And you said you want these particles suspended in the air. Are they going to be suspended in the air for such a long time that this kind of has to be done at night after? You can't have people this isn't something a business can do while it's operating,
No,
correct?
this would have to be an off hours activity. And great question, Andrew. It's typically only done as part of an EIDR or an EOP, as part of an emergency procedure. No one's going to be doing a pull down every day. Remember, we're talking about touchable surfaces. That's really what I'm most concerned about. And that's what everyone needs to focus on, because you can't do it all. You just can't. But when you've had someone sick in a space, then a pull down suddenly becomes a really attractive technique to say, you know what, before I send in my people to clean all those surfaces, I'm going to do a pull down to get everything I can out of the air. That's legit.
That's great. And I think the context, I read the question from the gentleman, it disappeared. So I don't see his name, but he's saying, why are we so focused on surfaces when the EPA and the CDC, and certainly if you read the news or watch the news, they're constantly saying that it's, the virus in the air is really what we got to be most concerned about in terms of infection. They're saying that, surfaces is a possible route, but it's not the main route that infection occurs upon. And I think to your point, what we're really talking about is mitigating, right? So we can't get all the virus out of the air. We're trying to, do this balance of what's possible, what's ideal and what's possible, right? Like business has to continue. And so we're not going to live in a zero risk world. We're in this new world, right?
Sure.
So we're going to ask people to wear masks. We're going to try and limit. So those are the kinds of measures we're going to put in place to kind of keep the air transmission down, reducing capacity, masks, those kinds of things. And then, but surfaces we can control. And so I think to kind of speak a little further on, I think what the question asker was getting at, which is, we maybe can't solve all these problems for you guys, but if we could solve one, if we could at least eliminate surfaces as a concern or mitigate it is really the better word. That's kind of what we're trying to do. I mean, hopefully that answered your question.
Yeah, two quick comments on that, Andrew, because you bring it up. There are quick sound bites and there are bigger sound bites in this world. If you listen to anybody who gives you an expanded sound bite, they're going to say, we're not as concerned about surfaces, but we're not telling you not to treat them. And CDC is very blunt to people like schools and buses saying, you should do this daily. So in the big picture, we're trying to encourage people to wear masks. So we're telling them breath is the big deal. And we're downplaying surfaces because surfaces are less of a mission critical item than getting people to wear masks. But for the people who own and are responsible for buildings, especially if it's a public building, the last thing you want is local channel 7 coming in and running an ATP test on a surface and then running around telling everybody this place is filthy. And stuff like that happens. We know it happens. So I mean, for our people's own good, we need to do it. We also need to do it for the good of our businesses.
Yeah, I think you made a good point in when one of our conversations kind of leading up to this event, and it's, the media is great. The media is, giving us all this information. They're doing their jobs. But what the media is not great at, they're not scientists. They're not specialists in remediation, and they don't always get the terminology right. They don't always get the words right. They don't always get the nuance right. So it's very easy to hear these things on the news, and then you're kind of hearing a whisper down the lane situation. You got public health experts saying, and the CDC saying you should do X, and then the media hears it and they kind of say something a little bit different. And then by the time it gets to your ears, if that's your main source of information, you're hearing, well, I don't have to worry about surfaces. And when that first started getting reported, I think I first started hearing that, back in maybe May or early June. It
was May 20th.
We had a sales meeting the next day. Oh, do we pack up and stop selling disinfectants? They're saying you don't need to disinfect anymore. And it's like, well, hold on, that's not exactly what they said, is it? Right. So I'm definitely hearing, and going back to the headline of the event, the fact and fiction thing. There's the outright misinformation, and then there's just the misunderstandings that happen, and I see that a lot. So I think that's important to kind of clarify.
I got another question here from Ed. He's asking, do the surfaces need to be wet for 10 minutes before wiping dry?
Wet continuously for 10 minutes. If you need to reapply partway through, that's fine. So when we talk with people in Arizona where it's just unbelievably dry and 125 degrees, you're probably going to apply multiple times before that surface is 10 minutes wet. But yes, 10 minutes wet is what we need to get to 99.999%. Now, do we get most of the microorganisms in the first minute or two? Sure we do. Of course we do. And we get all the easy ones in the first minute or two. Coronaviruses are easy to kill. But we can't go by that. We need to go by surfaces have multiple organisms on them. And what is our rule of thumb by which we're going to get them to a surface that is free of pathogenic microbes, pathogenic meaning disease causing? And that's 10 minutes. There are some organisms that take even longer than 10, but for the most part, what you have on surfaces where people live and work is 10 minutes.
Yeah, and that brings up a great question I had while you were talking, which is, so you've got a product that's all in one. It's a cleaner and disinfectant, and you kind of touched on it, but I'm, putting myself in the shoes of someone who's, got a business and they're trying to maintain surface. So what does that really look like, right? So it's a cleaner and disinfectant. So maybe they're putting it on, wiping it to kind of using it as a cleaner as you would, and then what? And then after they're done cleaning, it's two steps with the same product. So they're going to apply the product, clean with it, say with a rag, and then after they've done that, they're going to spray it again and then wait 10 minutes. Is that kind of?
They're going to spray it again and walk away. They don't need to watch it for 10 minutes.
Sure.
And this is, I'll give you an example. A college I was working with on Friday said, well, we've got this other product that has a 1 minute contact time. And I explained the whole issue with other organisms, but I said also, read that EPA label real close. That EPA label says wipe. It doesn't say you can wipe if you want to. It doesn't say air dry or wipe. It says wipe, which means it's a command. So I might have a 1 minute contact time, but how much time am I going to spend wiping each desk in that classroom? So work with us when you're looking at various products. Give us a chance to do a little analysis, and we might surprise you with showing you where the actual true costs lie.
Right. And we're seeing all that kind of stuff too. I mean, I've seen all sorts of products that, say that they can disinfect your surface for a week. They can disinfect your surface for 48 hours. They can disinfect your surface for all sorts of extended periods of time. I mean, the other thing I'm seeing is coatings. Some of them might have silver or antimicrobial coatings or antimicrobial resistant coatings. Many of them are silver or copper or some kind of metal. Can you speak on that for a little bit?
Every single one of them is bacteria, not viruses. None of them have viral claims. One of the great things about this technology, is on our computers, we can do word search. So open up the label on the computer and search for the word virus. And if it doesn't appear on their label anywhere, then you can't use it for viruses. I mean, it's a really quick way. You don't have to read the whole label. You can just do a word search. All of these products with silver, we used to have a silver-based disinfectant, so we're very familiar with the technology. Nothing wrong with it. It's a good disinfectant. And on a couple of different bacteria, you can generate data in the lab showing that it will resist recolonization of that bacteria. And that's its value proposition. So if you're worried about those couple of bacteria that silver is effective against for 24 hours, then that's a great product for you. But if you're thinking about it for COVID, guess what? You're using the wrong tool in the toolbox. There are no products that last. I had EPA's language in there 3 times. No EPA registered product that provides virus static performance.
Got another it's a great question here. Pretty lengthy, so you might want to sit here for a second. The main question is, what do you think about UV disinfection? And the question also adds, Philips, GE, as well as many other respected businesses that have existed for 30 plus years have proven 99.99% disinfection of COVID-19. They added that there are definitely downsides to the use of chemical disinfectants and UV disinfection. However, there are proven benefits to using both techniques of disinfecting in tangent with each other. They're asking also, do you recommend the use of just chemicals as a disinfectant, or do you recommend a strategy kind of using both of these, UV and chemical? And then they added, this is not to say you would also clean the surface before disinfecting.
He's not discounting cleaning the surface, saying, yeah, we still have to clean the surface regardless if it's UV or chemical. I'm never a fan of having a strategy that has just one technique in it. I think, for example, I'm going to advocate a lot of times for people's personal goods that you lock them up in a Connex box or a storage facility for 3 or 4 weeks, deny them a host, and let the virus starve to death. That's safer and better than cleaning some things. So, common sense stuff like that can be done too. So ultraviolet, certainly ultraviolet, which is UVC, which is not naturally occurring, has proven capabilities, without beyond a shadow of a doubt. The problem is in implementation. That's always where the problem is. So ultraviolet has a similar issue, like contact time. It needs a certain contact time at a certain degree of intensity in order to work. And while it may work on the surfaces where the light is striking for an adequate period of time, unless the light moves or the surface moves, then you're going to have surfaces that weren't facing the light source that are going to remain untreated. This has been one of the problems in the subways in Moscow. They were using ultraviolet lights that they would hang in the middle of the car, but everything that was in shadow wasn't getting treated. And of course, when you're holding a pole in a subway car and you wrap your hand around it, you're wrapping it all the way around it. So I think ultraviolet can be effective in HVAC systems, provided the air isn't moving so fast that the microbe doesn't get the contact time it needs. Same thing goes for air plenums. There was a big story in Seattle about restaurants that were doing ultraviolet in the area above the drop ceiling. If you can get enough air to get treated with the UVC, then that makes sense. What worries me is when people flash a blue bulb and say, we're good. It works in hospitals and in patient rooms that are specially designed for UV, because the tool is designed to hit absolutely every surface in there. It's almost automated like a robot. That's the kind of controlled conditions you need for UV to work. So I'm not putting it down. I'm just saying, in the COVID world, when I'm going from building to building and every building has different angles and needs and populations and occupants, my ability to use UV is going to get limited because I'm changing variables every building to building.
Yeah. So I think all of that is great points. I mean, I think, another controlled example, I mean, those little boxes that you can put your cell phones in that have UV, I think those are great. I think that makes sense. That's certainly a small area where you can ensure that and cell phones, as we know, even before COVID, we were reading articles saying, the breeding grounds that these cell phones have been for all sorts of organisms. So I think that's a great application for UV. The other thing to add to that is, is EPA. I mean, the EPA has not approved or put on any kind of list. So maybe it works, and maybe we know it works, and we know it works on viruses. But if you're trying to go by the book in terms of compliance and all that kind of stuff, if it gets to a point where someone gets sick and they say, okay, well, what did you do? And we only did UV, we didn't use a liquid disinfectant. That's going to say, well, did you do your due diligence? So that's one thing we think about. And then there's the OSHA. We sell UV lights that we use with adhesives for UV cured adhesives, and there's all sorts of stipulations with that too. That if you're going to have a person holding a UV wand, they got to have the eye protection, and then once you get to a certain amount of exposure with eye protection, they got to get their eyes checked at a certain frequency, and there's definitely some health impact for UV that you got to be thinking about.
Those are really great points. Some of those I hadn't heard before. That's super.
Yeah, so it's definitely something to consider. So we have another guy kind of commenting on that, same thing with UV in swimming pools. And I think that's a great example. He's saying UV in swimming pools, a mixing chamber is used to create longer contact time. But, a swimming pool is 15 to 40,000 gallons sitting in a huge container. So that's a great example of how it can take a lot of time to really, if you imagine the same thing is happening with water, it's the same thing that's happening in the air in these UV ducts. So there has to be sufficient contact for the UV to be attacking these viruses in the air. Well, while we're waiting for another question, something that I think people might want to hear about is we hear about these botanical disinfectants, we hear about the Decon 30. And I think there's still not, I talked to a lot of people, there's still not a lot of awareness on what is a botanical disinfectant, what are the advantages. Me as a father of, I've got a 1-year-old at home, and you worry about everything you hear about in the schools. I've talked to a lot of people that say, how are they going to disinfect these schools? They got these kids, they put their face in their mouths constantly. They're putting everything in their mouths. I mean, can you speak on that a little bit about how a botanical disinfectant might be interesting to an end user for different things?
Absolutely. So most of the botanical disinfectants don't require a rinse even on food contact surfaces, which is a benefit. Now, most of the conventional products don't need a rinse either, except on food contact surfaces. By food contact, I mean things like a cutting board, not a wall in a kitchen. But it's an advantage. Now, EPA evaluates toxicity in a 4-stage process. So a product rated 1, number 1, is the most toxic relative to other disinfectants, and a product labeled 4 is the least toxic relative to other disinfectants. The botanicals are designed to fall into the category 4, least toxic. And then if you look at the label very carefully, and you got to look at the label, there are there's some great label language on there, like can be used in daycares explicitly, can be used on children's toys explicitly, without a rinse explicitly. Those are great things to see if I'm running a preschool or something like that. The botanical products start to diverge when you look at what they're actually made out of. Miracles of modern chemistry, you have naturally occurring substances, and then you can synthesize naturally occurring substances and make something almost the same. So what has happened is, because it's so expensive to actually pull a plant out of the ground, press its leaves for oil, harvest that oil, refine that oil, do it enough times to actually get enough of that oil, and then make a disinfectant out of it, that is a barrier to entry. So there's one botanical manufacturer, and that's the Benefect label, which is our label. And then there are a series of, there are 3 or 4 of them, brands that are called synthetic botanicals. And they proudly call themselves synthetic botanicals. And they say, well, we don't smell as natural, and you don't have to shake our product, but we're the same thing, just cheaper. No, you're not the same thing. You're made from petrochemical substances. There's a reason you don't have some of the same language on the label. Yes, you're an EPA category 4, but you are not naturally derived. And who knows how allergenic the product is. So, if you were, and they're all expensive. I mean, the botanical products, whether they're synthetic or natural, are all premiums. As you would, just like organic at the supermarket, you pay more. So if I'm going to pay more for a botanical, then I'm going to buy the botanical that's actually botanical. I'm not going to buy this synthetic. Synthetic botanical sounds like an oxymoron to me. 2 terms that don't go together. And there's a lot of disinfectants out there, frankly, that are fruity. Forget botanical. They're just conventional products that just have perfumes, make them smell like oranges and cherries and whatever. And one of the problems, the last thing I'll say is one of the problems, and this is not aimed at my friends at Chemical Concepts, but in the Jansan business, you've got salespeople who go into places like schools and talk to people who they've sold cleaning chemicals to for years and say, this stuff's so safe you can drink it. I can't tell you how often I hear that. No, it's not. It has an EPA registration number. It's a pesticide. EPA regulates pesticides. No one goes and drinks a pesticide. I don't care how safe you think it is. So I'll stop there because my sermon on botanicals could probably go on. But that's probably enough.
Yeah, but I think you brought up some really great points there. And so just going back to what you said in terms of, having tools in the toolbox. I mean, maybe certain people might want the Benefect or the Decon 30 over the Shockwave, but I think there's a lot of applications where maybe you want to have, it makes sense to have both in your toolbox, and you're going to use one product for certain applications and one product for another applications. So
if there's an institutional decision makers on this call, you want both. I mean, from a scientific side, from a cleaning side, I love to have my Benefect around because it has an acid pH. My Shockwave has an alkaline pH. I know products that are above 7 pH, alkaline pH, usually degrease things really well, and they emulsify really well. They clean really well. But sometimes I want something that's acid-based. Or, another example would be, let's say I'm running a office building in Chicago that's got a pigeon problem. Well, my Shockwave is actually explicitly EPA registered for the Cryptococcus neoformans organism that is of concern, that causes histoplasmosis in pigeon. That's really cool. The fact that I have a product already on the shelf that has all these specialized uses, it's like a smart bomb that I can deploy whenever I need it. The botanical labels aren't as big. They've never been as big in that side of the business, primarily because all they were focused on was being botanical. So having both, the cost of managing the two disinfectants is incremental. And it means that you've got problem solutions in-house ready to go.
Great. Well, let's see how we're doing time-wise. So we're at 3:22. Do we have, I think we could probably keep Cole busy all day. I think some of the questions have do we have any more questions from the crowd for any of you 22 folks that are still with us? Any pressing things? We'll give kind of a last call for questions. That's a great point. So we have Tony talking about pH versus alkaline, very important for dealing with natural stone like marble. That's a great point. A lot of people in our network, obviously we do a lot of business with the natural stone fabrication folks. So that's a question that we get all the time, is what can I use on my surfaces? For those of you that don't know, we sell dry treats. So we sell, we are a dry treat distributor for their line of sealers and cleaners. And ICP is a umbrella company that includes dry treat. So this is a kind of a sister company to the dry treat. And another kind of piggybacking on that comment is, it's part of dry treat's warranty that both the Shockwave and the Benefect are kind of approved for surfaces that are treated with the dry treat. So if you have customers or you install a lot of products that use a dry treat sealer, another neat little tidbit is that you can tell your customers that both Shockwave and Benefect Decon 30 can both be applied to your countertop and not, disturb your warranty. And, pH versus alkaline, if you're working with marble, marble is a calcitic stone. So, it does not want to see anything with a acid pH. So refresh my memory, Cole. You said which one was which one is more alkaline?
The Benefect products are between 4 and 5, so they're acid. Neutral is at 7. The Shockwave Ready to Use is between 11 and 12. 12, of course, is the threshold beyond which you're corrosive. And the Shockwave Concentrate is, I think, 12 to 13, but once you mix it, it's 9.5 to 10.
Right. So if you're using with marble, you probably would rather, for granite, you'd be fine with either one. For quartz, you'd probably be fine with either one. For the marble, you probably want to use the Shockwave because you would not want to use anything acidic on a natural marble countertop for sure. Okay, well, I think we gave people some extra time for questions. I know this was kind of a longish webinar, but I think a lot of great information. But I'm sure a lot of you folks unfortunately have to get back to the rest of your day. So we'll start to kind of wrap this up. Again, we mentioned that we'd throw the contact information up on the screen. So you got my personal email address. You have the email address for our sales team, our number, our email, our website. We're going to be sending out a recording that was mentioned earlier. So by tomorrow morning, I'm not sure exactly what time it's going out, but you're going to get a copy of the slide deck. You're going to get a recording. These links will all work in the slide deck that you're going to receive. So feel free to reach out to us. We certainly are happy to help you with that. And any final comments from Cole or John?
I'd like to thank Cole. This highly informative. Hopefully everyone took something away from this. And obviously, if you have any questions, we'll get Cole involved, or you can ask us. We've been learning more and more as time's going on, and Cole's taught us a lot. So any questions you may have, please feel free to reach out.
Thanks to both of you guys and to Lydia and to everybody at Chemical Concepts. I really enjoy teaching, especially with partners like you guys.
All right. Well, we'll leave it there. So thank you again, Cole. Thanks to everyone who joined us. Have a great afternoon, and we hope to talk to you soon.